A country like India, the biggest impact will be by the government's micro health insurance program. Around 7 years ago, we started a concept called Yashaswini Micro Health Insurance Program, wherein farmers were asked to pay 5 rupees per month. For every 5 rupees they paid, state government paid 2.5 rupees. So this is how the micro health insurance was born. And 4 years ago, Tamil Nadu, the Andhra Pradesh government launched a similar program called Arogya Shri, which covered 80% of the state population and which is singularly responsible for Dr. Reddy to come back to power with thumping majority. Tamil Nadu government is launching a similar health insurance called Kalaingar insurance. So essentially what will happen is government will become a health insurance provider, not a healthcare provider. And when that happens, for the healthcare providers like us, whether he is rich or poor doesn't matter, because the rich people pay from the pocket and the poor people are paid by the insurance program. Our institution was created 10 years ago. We are just celebrating our 10th year. In fact, our hospital in Calcutta is 10 years old. This is 9 years old. And we started with a small hospital in Calcutta and a 250-bed hospital in Bangalore. Today, Bangalore hospital has become a health city. We have close to 3,000 beds here. In Calcutta, we have close to 750 beds. Our target is to add 30,000 beds in the next 5 to 7 years. We build large health cities in every hospital campus. We like to have at least 2,000 to 5,000 beds. We somehow are not very comfortable with the 100-bed, 200-bed hospital models, because in these models you can't reduce the cost because healthcare is expensive. We have to buy very expensive CTs, MRIs, blood bank machines, laboratories. For you to reduce the price, you need to have thousands and thousands of patients who are going to avail those services. Around 8 years ago, we tied up with the Indian Space Research Organization, which gave us the satellite connection free of cost. There are 5 countries in the world which can put a satellite on the space, and we are privileged to be one of those countries. We get the satellite connection free of cost. Using the satellite, we created coronary care units in remote parts of the country like Tripura, Siliguri, Bankura, Chamarajanagar, all these remote areas where there are no cardiologists. Using the satellite link up, using very ordinary doctors, we have done extraordinary things in terms of treating over 53,000 heart patients in remote locations. Yeah, without the benefit of the telemedicine, most of them wouldn't have been alive today. We are linked to over 100 centers all across the country. We get over few hundred ECGs every day from remote locations of India, from small clinics located in remote areas. So we are fairly aggressively creating this network of virtual network where patients can access us. And now with the mobile phone becoming ubiquitous, at some point of time, we may be able to offer healthcare through mobile phone. I feel that none of these IT or non-IT companies, they are not spending enough time to understand how the healthcare industry runs. The healthcare industry is a very complex industry to run because minor error in your services can result in disaster. Somehow the IT specialists not spend much time to understand how this industry runs. So to be honest with you, today in terms of IT support for a hospital, all across the world, there is not even a single success story. There is not even a single happy story. Around 5 years ago, one particular hospital in the US, after spending 6 years and $600 million for IT support from one of the world's top company, they just wrote off their cost and they squashed the whole program. So the biggest problem is unless the IT companies, software professionals are willing to spend a lot of time to know what our wants are, because the greatest difficulty is as end users, we don't know what we want. When you give a set of our requirements, we change our requirements. So someone should have the patience to understand, because we are not scientists, we are artists. So you have to treat us like artists. We are very unpredictable. Healthcare industry, once it adopts and embraces technology, we will have phenomenal gains, phenomenal, mind-boggling gains. Priority keeps changing. 10 years ago, I didn't want to spend money. So we always looked at cheaper IT solutions. We have quoted many IT companies from various places, various parts of the world. In the end, we have nothing in hand. After spending more than 15 years of trying to develop ideal software, it was a disastrous experience. Now we decided to go to the top. So we have bought Oracle as the ERP solution. And we have tied up with SRIT for the hospital information system. This is the best one could get. So now we decided that it's going to cost money and we cannot compromise on that. So we may as well go for the best. First thing is we need to have a very robust system. That's the reason why we settled down for Oracle. Now our software guys are just working in terms of putting all the data. Hopefully within a year, we will have a very good hospital software network. I feel that Oracle is ideally suitable as a ERP provider for our organization, because we have hospitals in 6-7 cities right now. It is going to be in over 100 locations. So if you have to get all the information and compare your data, compare your the input costs, output costs, your outcomes, hospital stay, we feel that Oracle will be able to deliver. Predominantly we started the project with our own money, and at some point of time when we wanted to grow fast, we had a investment from JP Morgan and AIG. Essentially, we are a company which is supported by Kiran Mazumdar-Shaw, myself, and these private equity companies have a small stake. We are in the process of setting up a large health city in Cayman Island, and we get large number of patients from different parts of the world. Over 20% of the patients we treat here come from abroad. All the children who are born with complex congenital heart disease in Malaysia, they come here for the heart operation, and Malaysian government pays for it. At some point of time, we are trying to set up a hospital in Malaysia. We have many plans in different parts of the world. Large number of country governments wants us to come there. But we are just being very choosy right now. About four years ago, our ex-president, Professor Abdul Kalam, he had a vision that Indian doctors sitting in Indian hospital should take care of the healthcare of poor people in Africa who are not well connected. The beauty of satellite is it doesn't require any landline. So the Indian satellites are now beamed to 56 cities of Africa, and we are linked to those cities. Our doctor sitting here can treat heart patients or a diabetic patient or a kidney patient. It's a great experience. I thought it is an important tool long time. Now I feel it is inevitable. If you want to control the cost without a robust IT backbone, you will never be able. You can only guess. If you want the absolute figure, when your margin is hardly 4-5%, it is very important that you have a robust system, because few percentage here and there, you land up in serious problem. There is no other choice. I want them to give precise information, accurate information. I'm a surgeon. For us, it could be this or it could be that. Doesn't make any, doesn't make any sense. For us, when I say that when I finish this operation, what is the cost of the material used for the operation here, and what is the cost of material used in Calcutta or Jamshedpur, whatever. We want the actual figure. We don't want any approximate figures. Based on that, we can make a lot of changes in your strategy. I'm not a gadget savvy person. I don't understand technology, but I am surrounded by people who understand technology extremely well. So when I started working with the scientists from ISRO, because I didn't understand how the satellite network and the bandwidth and all that works, I kept asking them what was at that time considered impossible. And I didn't settle down for what they had to offer. I said, this is the absolute pre-requirement. In the sense, ISRO wanted us to manage with a relatively unclear picture. See, in my business, when I am looking at a patient from the distance, patient has to see the compassion on my face on the TV. If he doesn't see the compassion, he's not going to take my advice. So I didn't want to understand what the problem the scientists have. I said, unless you provide it, this telemedicine is not going to take off. But believe me, in less than a couple of months, they provided everything. Today we have a fantastic telemedicine network.